Okay, you just heard from 4 Americans who shared why they do not want to get the COVID vaccine. Dr. Joseph Varon, the chief of staff at United Memorial Medical Center in Houston, was listening in on that conversation, and he will now give those panelists his thoughts after he has seen scores of COVID patients die. Here's part 2 of Pulse of the People. Dr. Varon, you have your work cut out for you, obviously, because all of these folks say they've done their research. They have, really strong opinions. So, Dr. Varon, what jumped out at you?
Well, first of all, I do hear a lot of misconceptions, that are to some extent dangerous. And I mean, I have no problem in somebody telling me, hey, I think that my immunity is good enough and I don't need anything else. If that's the case, then my recommendation would be just go ahead and check your levels, see what are your antibodies, see where you stand. Now, there is also very interesting data that actually shows that if you get the vaccine after you have the COVID, you have about 100% chance that you will not get the COVID that's going to get you in the ICU or kill you, which is fantastic.
I've spoken to some of the best epidemiologists in the world. They say it's unequivocally established in their opinion that immunity is long-lasting.
Epidemiologists may tell you whatever they want, but they just manage numbers. I am seeing this day in and day out. I have seen people that have COVID once, and I know, but it's not science, but it's the reality. The reality is that I have seen patients that have COVID once, and they come again with COVID the second time, and they come in deadly ill. I mean, I've had a patient that had COVID 3 different times, once in March, once in July, and once in December. Same patient.
That you don't make policy based on anecdotes.
But Janine, just to be clear, Dr. Varon isn't making policy. He's a frontline worker in an emergency room. He's sharing with you his experience. I mean, he's telling you that people who have had COVID can get it again.
Nothing.
What?
And as a clinician, and my views are based on my years of education, training, and experience that I have gained, unfortunately, after taking care of a couple of thousand patients with severe COVID in my hospital, of which a lot of them died.
I've known a lot of doctors at private practices and in the ERs that treated COVID a lot differently. They didn't send people home and wait till they got bad and it was too late to come in. But nobody in the media across the country wants to talk about preventative or prophylaxis.
Okay, but Jennifer, that's just not true. We would have loved to have talked about therapeutics, but they have to work. I mean, they have to actually have some testing behind it. But hold on, I just want to go through a couple of things that they brought up, Dr. Varon. Autoimmune disease. Do you agree that someone with an autoimmune disease should go slow when it comes to the vaccine?
I'm in agreement with that. I believe that people with autoimmune disorders need to be a little more careful.
Okay, but what about, Dr. Varon, what so many people are concerned about the connection to blood clots. Have you seen that in your hospital?
We haven't seen it. It's so rare. I mean,
no, I'm sorry, but no, that's not true. Nobody is being made right now to report these adverse reactions properly.
So to her point, on April 23rd, 2021, Janssen Biotech, which is J&J, did put out another notice about, and it's right here, and you can go on the web and you can find it, which states that most cases of thrombosis and thrombocytopenia were occurred in females ages 18 through 49, and some have been fatal.
But I mean, still, even with that, I think that it was a handful. And I'm not obviously discounting their deaths, but I'm saying that of the millions of people who've gotten the vaccine, that I think that they can still count it on 2 hands how many females in that age range died.
My question for the doctor, he said he had a patient who came in and he or she had COVID-19 3 times within a year. Were they vaccinated?
They were not vaccinated. That's the whole point. Not a single one of the patients that I have seen with COVID-19 requiring admission to my COVID ICU have had the COVID vaccine. Today, I admitted 3 of them. And when you talk to them, they all give you a reason, very similar to some of the ones that you guys are saying. And now these patients are about to be on a respirator. So that's why you guys need to understand. And I'm looking at the greater good. I understand that there may be a risk. There is a risk of everything, for God's sake. But what I'm trying is to save as many lives as we can.
What's great about that conversation is that I didn't hear any rabid, committed anti-vaxxers.
No.
You can decide if, their concerns are reasonable. No, but there was no talk of computer chips or or trying to inject something nefarious into
And a lot of
people.
them have gotten other vaccines.
Yeah.
They have gotten some of the standard vaccines, but this one they feel is too soon. And I understand that not everybody is always the first person through the gate. Some people need to take a breath, take a year, and wait. The problem is that then Dr. Varon has to treat the people. I mean, what he's gone through, that is the man who has worked 444 days straight without taking a single day off because he was so overrun with COVID patients. So there's a consequence to not wanting to be the first out of the gate. But I'm not saying that they're wrong. In fact, I always learn something from our panelists, and I really appreciate them coming on and being willing to be on national TV and sharing their perspective on all of that.
Yeah, it certainly is not easy. And I remember DJ Quicksilver from when I was living in D.C. Good to see him again.
That's right.